Here are 10 Puerto Rico medical bull-style clinical vignettes focused on autoimmune diseases, each with 4 answer choices and detailed explanations. Vignette 1, Systemic Lupus Erythematosus, SLE. A 28-year-old woman presents with fatigue, joint pain, and a malar rash. Labs show positive ANA, anti-dsDNA, and low complement levels. What is the most serious potential complication? A. Rheumatoid arthritis. B. Lupus nephritis. C. Autoimmune hemolytic anemia. D. Sjögren syndrome. Answer B. Lupus nephritis. Explanation: SLE is an autoimmune disorder affecting multiple organs. Anti-dsDNA is associated with lupus nephritis, which can cause renal failure. Patients require renal biopsy and treatment with immunosuppressants. Vignette 2, Rheumatoid arthritis, RA. A 52-year-old woman presents with morning stiffness lasting over 1 hour, symmetric joint pain, and swollen PIP and MCP joints. What is the most likely finding on lab tests? A. Positive RF and anti-CCP. B. Positive ANA and anti-dsDNA. C. Hyperuricemia. D. Elevated creatine kinase. Answer A. Positive RF and anti-cyclic RA is an autoimmune polyarthritis with positive rheumatoid factor F and anti-cyclic citrullonated peptide anti-CCP antibodies. Treatment includes DMARDs, e.g. methotrexate. Vignette 3. Sjögren syndrome. A 45-year-old woman presents with dry eyes, dry mouth, and enlarged parotid glands. What is the best initial test? A. Schirmer test. B. Anti-dsDNA. C. Rheumatoid factor. D. Skin biopsy. Answer: Schirmer test. Explanation: Sjögren syndrome is an autoimmune disorder affecting exocrine glands. The Schirmer test measures tear production. Confirmatory tests include anti-Rho SSA and anti-La SSB antibodies. Vignette 4, Scleroderma, systemic sclerosis. A 40-year-old woman presents with tight skin, Raynaud's phenomenon, and esophageal dysmotility. What autoantibody is most specific for diffuse systemic sclerosis? A. Anti-centromere. B. Anti-Scil70, topoisomerase 1. C. Anti-Rho SSA. D. Anti-dsDNA. Answer B. Anti-Scil70, topoisomerase 1. Explanation: diffuse systemic sclerosis involves skin tightening and organ fibrosis. Anti-Scil70 is associated with diffuse disease, while anti-centromere is linked to limited scleroderma, Crest syndrome. Vignette 5, Mixed connective tissue disease. A 37-year-old woman has symptoms of lupus, scleroderma, and myositis. Labs reveal anti-U1 ribonucleoprotein, RNP antibodies. What is the best initial treatment? A. NSAIDs. B. Hydroxychloroquine. C. Prednisone. D. Rituximab. Answer C. Explanation is an overlap syndrome with features of SLE, scleroderma, and myositis. Anti-U1 RNP antibodies are characteristic. Corticosteroids, e.g. prednisone, are first-line treatment. Vignette 6, Polymyositis. A 50-year-old woman presents with progressive proximal muscle weakness but no skin rash. Labs show elevated CK and positive anti-Jo1 antibodies. What is the most likely diagnosis? A. Dermatomyositis. B. Myasthenia gravis. C. D. Guillain-Barré syndrome. Answer C. Polymyositis. Explanation: polymyositis is an inflammatory myopathy causing proximal muscle weakness. Anti-Jo1 antibodies suggest immune-mediated myositis. Treatment: steroids and immunosuppressants. Vignette 7, Dermatomyositis. A 45-year-old woman presents with proximal muscle weakness and a heliotrope rash around the eyes. What cancer is she most at risk for? A. Ovarian cancer. B. Colon cancer. C. Breast cancer. D. Pancreatic cancer. Answer A. Ovarian cancer. Explanation: dermatomyositis is paraneoplastic in 15 to 25% of cases, especially associated with ovarian, lung, and gastric cancer. Gottron's papules and heliotrope rash are classic findings. Vignette 8, Goodpasture syndrome. A 30-year-old man presents with hemoptysis and hematuria. Labs show anti-GBM antibodies, and lung biopsy reveals linear IgG deposition. What is the best initial treatment? A. Prednisone and cyclophosphamide. B. Hydroxychloroquine. C. Plasmapheresis. D. Methotrexate. C. Plasmapheresis. Explanation: Goodpasture syndrome is autoimmune against the glomerular basement membrane, GBM, leading to pulmonary hemorrhage and rapidly progressive glomerulonephritis. Plasmapheresis removes autoantibodies, followed by steroids plus cyclophosphamide. Vignette 9, Myasthenia gravis, MG. A 26-year-old woman has fatigable ptosis and weakness that worsens throughout the day. What is the most specific diagnostic test? A. Ice pack test. B. Erythematosus test. C. Anti-acetylcholine receptor antibody test. D. Muscle biopsy. Answer C. Anti-acetylcholine receptor antibody test. Explanation. The MG is caused by autoantibodies against acetylcholine receptors, leading to fatigable muscle weakness. The anti-AChR antibody test is diagnostic, but the ice pack test and Erythematosus test can help confirm. Vignette 10. Guillain-Barré syndrome, GBS. A 32-year-old man develops ascending muscle weakness after a recent Campylobacter jejuni infection. What is the most appropriate treatment? A. IV steroids. B. IVIG or plasmapheresis. C. Azathioprine. D. Methotrexate. B. IVIG or plasmapheresis. Explanation is caused by autoimmune attack on peripheral nerve myelin. IVIG or plasmapheresis accelerates recovery by removing autoantibodies. Steroids are not effective. Final thoughts.